So you've likely heard conversations happening online, around your office, or with your loved ones after President Donald Trump and Robert F. Kennedy encouraged women to avoid acetaminophen, the active ingredient in Tylenol, during pregnancy, saying it's linked to autism in children.
I know this has been a big talker among many of my mom friends. Well, an FDA letter tells doctors now to advise patients to avoid that drug.
They are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
Well, this guidance has been rejected by many medical professionals.
Tonight, KSHB 41 News reporter Jian Kim is listening to the voices of those who work with kids with autism every day, along with a parent and a doctor. We listen to their perspectives to understand the impacts of this latest guidance.
Here at Kansas City Autism Training Center,
I think it's youth cupcake.
Children on the spectrum get evidence-based intervention and treatment.
Challenges or abilities can have a really wide variety and look a lot of different ways.
According to the CDC, autism spectrum disorder affects 1 in 31 children in the U.S. A big announcement from the White House Monday.
Today, the FDA will issue a physician's notice about the risk of acetaminophen during pregnancy.
The Trump administration warning pregnant women that taking acetaminophen, the active ingredient in Tylenol, may be linked to autism in children.
An announcement like this is kind of adding an emotional toll and stress on families when really their focus should be on trying to do what's best to help their child.
Aaron Kirby, a dad to children with autism, talked to KSHB 41 about that emotional toll.
As a father, it weighs pretty heavily because you always wonder, with all of this extra noise, was there something that my wife and I did prenatal that may have caused this diagnosis?
Many health organizations, including the American College of OBGYNs, have rejected the administration's claim, saying today's announcement by HHS is not backed by the full body of scientific evidence, adding acetaminophen is one of the few options available to pregnant patients to treat pain and fever, which can be harmful to pregnant people when left untreated. Experts say determining one environmental factor for autism is difficult, but genetics is a big proven factor.
It's almost certain that this is going to cause a lot more confusion when you're receiving fragmented and dissenting messaging from our public health officials.
You want what, turtle?
Staff here at the KC Autism Training Center says whatever conversations may be happening on the outside, within these four walls, their focus will always be the students they serve.
Not worrying so much about a cure and focusing more on what skills we can teach and how we can help support families and help those children live their lives to the fullest.
Jian Kim, KSHB 41 News.